Let's start with diffuse basophilia. The cytoplasm stains bluish to dark blue and may show granules or fine filaments, which are leftover ribosomal RNA. This diffuse basophilia indicates immature RBCs or reticulocytes, freshly released from the bone marrow, a sign of reticulocytosis and active red blood cell production. On a Wright-stained blood smear, the cytoplasm of reticulocytes has a bluish tinge. This is called polychromasia because the cells stain both blue and pink, reflecting a mix of RNA and hemoglobin. Polychromasia is often seen in conditions where the bone marrow is working overtime. This happens in hemolytic anemia, where red blood cells are being destroyed, or during recovery from deficiencies like iron, vitamin B12, or folate, which stimulate reticulocyte production. Basophilic stippling is an erythrocyte inclusion seen on a Wright-stained blood smear, where multiple dark blue to purple granules are scattered throughout the red cell cytoplasm, representing aggregated ribosomal RNA left behind in the cell. A high-yield distinction, diffuse basophilia or polychromasia, shows a uniform bluish cytoplasm and points to reticulocytes, while basophilic stippling appears as discrete, punctate granules scattered in the RBC. Basophilic stippling is classically seen in lead poisoning. Lead inhibits enzymes in heme synthesis, like ALA dehydratase and ferrochelatase, which prevents proper ribosomal RNA degradation and developing red blood cells, which results in those dark, punctate granules we call basophilic stippling. Howell-Jolly bodies are dense, round, dark blue-purple inclusions inside red blood cells, usually one per cell. They're made of DNA remnants, nuclear fragments, that the spleen normally removes. Howell-Jolly bodies appear mainly when the spleen is absent or not functioning properly, also called hyposplenism. The spleen normally filters out nuclear remnants, so when it's underactive or absent, these inclusions persist in circulating RBCs. Heinz bodies are denatured hemoglobin aggregates inside red blood cells. When stained with supravital stains, they appear as round inclusions near the cell membrane. Heinz bodies are generally not visible on standard Wright-stained blood smears. Heinz bodies are often seen in G6PD deficiency, a condition where red blood cells are highly sensitive to oxidative stress, causing hemoglobin to denature and form these inclusions. Spleen macrophages remove these denatured hemoglobin aggregates, creating bite cells on the peripheral smear. This process can lead to hemolytic anemia. Pappenheimer bodies are iron-containing granules. On a blood smear, they appear as small, irregular blue granules, usually near the edges of red blood cells, and are best seen with Wright stain or confirmed with Prussian blue stain. Pappenheimer bodies are commonly seen in sideroblastic anemia, where iron can't be properly incorporated into hemoglobin. In this condition, iron builds up in the mitochondria of developing red blood cells, and some of it forms granules inside red blood cells, which appear as Pappenheimer bodies on a blood smear. Cabot rings appear as thin, thread-like loops inside red blood cells, sometimes forming rings, figure eights, or loops. On a Wright or Giemsa-stained smear, they often look blue or reddish-purple, giving a characteristic looped or circular appearance. Cabot rings come from remnants of the mitotic spindle left behind during abnormal red blood cell division. Their presence is a marker of defective erythropoiesis. Cabot rings indicate impaired DNA synthesis in red blood cells, a hallmark of megaloblastic anemia, which usually results from vitamin B12 or folate deficiency. HBH inclusions are made of precipitated beta-globin chains inside red blood cells, most commonly seen in alpha thalassemia, especially HBH disease. On a supravital stain, they appear as small dark blue granules evenly spread throughout the cytoplasm, giving a characteristic golf ball appearance.